Hey, Dr. Mark Testa here. In today's video, I want to talk about thumb arthritis and give you 5 natural remedies that you can use today to start help diminishing that pain. So let's talk about this for a minute. The thumb is what makes us so different from our primate relatives. This opposable thumb, the ability to pinch and grasp things with it, is what makes us so different. And so when the thumb becomes arthritic and painful, it can really start to cause disability and dysfunction in our life, from things like opening jars or shaking hands or turning doorknobs. That can be very dysfunctioning in our life if you can't take care of yourself because you can't use your hand very well. Now, thumb arthritis is very common in women, 3 times more so than in their male counterparts, and literally 1 in 3 women will develop this thumb arthritis over the age of 50. Now, there seems to be a hormonal component to this, and estrogen in a woman's body is a natural anti-inflammatory. After menopause, when estrogen levels decrease, we start to see an increase in arthritis pain in women, even more painful than, again, in their male counterparts. So a bit of a hormonal component here. Now, steroids, not a great fix. I'll point to some resources in the description of this video that you can follow up on. Surgeries, spectrum of results and satisfaction from patients, but we're not going to talk about that too much here. But I do want to talk about the 5 natural remedies that, if you haven't tried, are worth considering. And that are hand strengthening exercises. We want to make sure that the muscles in the hand, particularly this thenar pad here, is strong. And you could grip a ball like a racket ball. Tennis ball would be too hard, but something that has some give, and doing it like this. Not so much squeezing it like this, but more with open fingers. You could put a rubber band on the back of the hand and fingers and open it up like this. I would also recommend finding a good hand therapist who could show you more of those exercises, or do joint mobilization. Sometimes we want to make sure this joint is sitting properly here because it moves in many different planes with all the different motions and functions of our thumb. So we want to make sure that it's moving appropriately. Number 3 would be acupuncture. I've done thousands and thousands of needles on thousands and thousands of patients, and acupuncture, if it's going to be beneficial, you should notice some results in 2 to 4 visits. Personally, I wouldn't recommend 10 or 12 visits of acupuncture because, again, if it's going to be helpful, it's going to be helpful sooner than later. So find a good, reputable acupuncturist in your community and have them address this situation. Number 4, nutritional supplements. Nutritional supplements can help manage healthy levels of inflammation. And those things could be like glucosamine sulfate or chondroitin sulfate or fish oil, or the Indian spice herb turmeric. These have been shown in human and rodent studies to help maintain healthy levels of inflammation, and certainly worth looking at. Also, number 5, topicals, something applied topically. Homeopathic arnica, again, in humans and in animal studies, have been shown to help maintain healthy levels of inflammation. And you can rub this on several times a day. And again, buy 1 tube, give it a try, see how it works. Now, let me give you a couple bonus ideas here. Heat can be beneficial. I know this is an inflammation, but sometimes getting blood flow and fresh blood to the area can be relieving and calming. So you could try 10 or 15 minutes of heat. If that doesn't do the trick, obviously ice. And you could do this in an ice bath. So I would recommend water and ice, and put your hand in it and submerge it and see how that feels. Now, bonus. 2 bonuses here. Have someone look at your neck. Make sure you don't have a pinched nerve from your neck coming down into your hand and affecting the function and muscles of the hand. And also, you would want to have someone look at the median nerve here. That's the nerve that gets compressed with carpal tunnel syndrome, and make sure the nerve function going to the hand is working adequately. Because if you try all this other stuff, you may be missing the primary source of it. So look farther upstream. And lastly, bonus number 2 would be find a Regenexx provider. Blood platelets and stem cell procedures can be really very beneficial to this. It's a great procedure for these if it's gone too far for these conservative measures, and I would encourage nothing but an evaluation and talking to a doctor to see if you can avoid surgery and steroids and other things. I'll put some notes in the description here. I hope this was helpful. If you found value, please like it and share it with your mom, your wife, your aunt, your girlfriend, and your grandmother, and let them know that there are solutions to this. And also, I do videos like this on a regular basis. If you'd like more health and wellness information like this, please subscribe to our channel below, and I'll see you in the next video.